I am Dr. Suresh Babu, Senior Consultant Neurologist and Epileptologist at Arete Hospital. Today I am going to talk about what is epilepsy and what are the reasons for it. And epilepsy is a very transient, sudden event and which is caused by the abnormal, excessive electrical activity in the brain which is involving the network. And the symptoms of the epilepsy depends upon the type of network involved. If the motor network is involved, you will see a tonic-clonic jerks or the facial jerks. If it is the sensory network, you will see any burning sensation, tingling and numbness or any abnormal sensation. And if it is a reticular activating system, you will lose the consciousness. If it is a temporal lobe, you will experience a different symptoms at the time like a epigastric pain or fear or illusion of the environment or hallucinations, etc. So symptoms depends on the type of network involved by the electrical activity. We divide the epilepsy into two types, focal epilepsy and generalized epilepsy. And the focal epilepsy is the only part of the network is involved. And the focal epilepsy is divided into simple partial seizures and the complex partial seizures. In simple partial seizures, there will be no loss of consciousness. Even though patient is having a seizures, their consciousness will not be altered. That seizure can be either motor, as I told, it can be just simple jerks or sensory phenomena, or it can be a autonomic phenomena or some kind of a experience which normally people will not feel. Whereas in complex partial seizures, they lose the awareness of the surroundings. Even though they will be with open eyes and observing the things, nothing will be registered in their mind and they have a amnesia for that event, whatever is happening. So opening eyes doesn't mean that they will be in a state of consciousness. These complex partial seizures commonly associate with the few automatisms like they do a chewing movements, sometimes they do a few movements with the hands and their eyes will be staring at one place or they may be looking around during that seizure. Whereas in a generalized seizures, you have a different varieties. What you commonly witness on the roadside is the generalized seizure. And these focal seizures can convert into the generalized. As we know, epilepsy is an electrical activity of the brain. If the electrical activity is confined to the small portion of the brain, you will see a focal seizure. If the electrical activity involves the whole brain, then you will see a generalized seizure. Sometimes these generalized seizures can be a focal converting into the generalized, or they can be a primary generalized seizure. A focal converting into a generalized seizure where small electrical activity spreads everywhere and you will get the generalized seizure. Whereas in a primary generalized seizure, you have a spontaneous generation of the electricity at multiple points in the brain simultaneously. So in a primary generalized epilepsy, you see they have a sudden fall followed by the jerks of the both hands and legs with some tongue bite, froth coming from the mouth, or there can be a simple myoclonic jerks, sudden body jerks. Especially you feel like something will be dropped from your hands. There will be something called atonic seizures. Just suddenly they fall without reason. Either it can be a forward or backward, or sometimes they can be only tonic seizures or the clonic seizures, etc. So based on the initial manifestation, we will divide they are the focal seizures or the generalized seizures.